Hello everyone. Now we are going to discuss a very important topic, primary healthcare elements and principles. This is important for short notes and Viva. And I'm Dr. Anusha, Assistant Professor in the Department of Community Medicine. Before going into primary healthcare, we will see what is healthcare. So it is defined as multitude of services rendered to individuals, families and communities by the agents of health services or professionals for the purpose of promoting, maintaining, monitoring and restoring health. And it will also include medical care. So medical care is a part of healthcare. So to understand in detail, we will see in the next slide. To understand in detail, we will see what is healthcare and medical care. Healthcare is a broader concept and it works for wellness principle. That means to maintain a healthy community, to maintain a sanitary environment and eating healthy foods and maintaining fitness. So it will come under healthcare. So it will focus on overall well-being, like holistic approach, and it will focus on disease prevention, health promotion, maintaining good health for populations, whereas medical care is concerned with specific treatment and diagnosis, like patient care and when hospitals, medical equipment, surgery, like that. It focus on diagnosing, treating specific illnesses like fever and treating injuries and other conditions in individual patients. And who will provide this health care means public health officials, nutritionists, health educators, wellness coaches, community workers, and even doctors also will provide health care. So it is a multidisciplinary team focused on community health, public policy and preventive programs. And who will provide medical care means agents of health care like physicians, surgeons, nurses, specialists, pharmacists, dentists. So licensed clinicians, doctors and nurses delivering direct to patient diagnosis, treatment and care in clinical settings. So this medical care is a part of healthcare, whereas healthcare is a broader concept. This primary health care concept came from health for all concept. So health for all term came in World Health Assembly May 1977. Health for all means attainment of health by all people who are living in this world by the year 2000, and it will permit everyone to lead socially and economically productive life. So that is nothing but all people residing in this world should be healthy. So health for all, and this goal is properly known as health for all. And from this health for all concept, primary health care concept came. So in the next year, in 1978, the WHO thought that how to achieve this health for all by 2000. How to achieve it thought, and this WHO in collaboration with the UNICEF and other organizations, they called representatives from all over the countries, all over the world. From each country, they called the representatives, and they held a conference known as Alma Ata conference. And there the representatives from all over the world discussed how to achieve this health for all. So and after thorough discussion, they came to conclusion that only through primary health care approach we can achieve health for all, like that they thought. And what is primary health care means? So we should keep people's health in people's hands only. Then only we can achieve this health for all, they thought. So primary health care is nothing but health by the people, for the people, and of the people. That is nothing but we should keep people's health in people's hands. So that is primary health care concept. So came after Alma Ata conference, like that. So by now we understood that this primary healthcare concept came after Alma Ata conference to achieve health for all by 2000 AD. So this primary healthcare concept came, and now we will see what is primary healthcare. Primary healthcare is essential healthcare made universally accessible to individuals and acceptable to them through their full participation and at a cost community and country can afford. So in community medicine, we should remember some definitions like health definition, primary healthcare definition, epidemiology definition, disaster definition, like that. We should remember some definitions. So they are very important. To remember any definitions, we should remember first hook terms or key terms. So in this primary healthcare, the key terms or hook terms are, first it is essential healthcare. That means it compulsory it should be there, essential healthcare. And how means it should be universally accessible. That means it should be accessible to everyone residing in the world. And we should give acceptable health care. That means whatever the health care we are giving, it should be acceptable to the people residing in the world. And how means they should utilize this primary health care through their full participation. Full participation is also nothing but community participation. That means people should involve. So with community participation only, as we discussed, every program will be successful. And at what cost means, at a cost the country and community can afford. That means at low cost, achieving higher health care. So like that. So these hook terms you should remember. And again I'm repeating, primary health care is essential health care made universally accessible to individuals and acceptable to them through their full participation and at a cost the community and country can afford. So this is the definition of primary health care. You should remember. So this is important for short notes. As I said, this definition itself will be asked in the Viva. And to give primary health care, we should utilize all these services. So this is not only about preventive, this is not only about curative, like that. So it is a combination of preventive services, promotive services, curative services, and rehabilitative services. All these services in combination are needed to give primary health care. Now we will see what are the elements of primary health care. That means in primary health care, what are the different things will be there. First is maternal and child health and family welfare. And second thing is immunization against vaccine preventable diseases. And third element is prevention and control of diseases. And fourth one is appropriate treatment of common diseases and injuries. And fifth one is provision of essential drugs. And sixth one is health education about basic illnesses and common illnesses. And seventh one is provision of food supply and proper nutrition. And eighth one is provision of safe water and sanitation. So these are eight elements of primary health care. So you can remember it like it is an octagon. Octagon means it will be having eight angles. So there are eight elements in the primary health care. And now we will see one more trick to remember elements of primary health care. So you can remember the mnemonic elements itself. So elements. So in elements first is E. So E we can remember like education regarding concerning or prevailing health problems in the community. So that you can remember. Next is L. L means we should have knowledge about locally endemic diseases and control measures. That is L. And third is E in elements. E means you can remember it like EPI, we know, no? Expanded Program on Immunization. So like that you can remember immunization against vaccine preventable diseases. And M is M. So in M we can remember it like giving maternal and child health care services. And fifth letter in elements is E again. So E means essential drugs, like that you can remember. So that is provision of essential drugs. One more element. And sixth letter here is N. So N is N for nutrition. So you can remember it like providing proper food and nutrition. And seventh letter is T. So T means treatment, like that you can remember. And one more element is treatment for common diseases and minor injuries. And the eighth letter in elements is S. S means safe, you should remember. So safe means provision of safe water and sanitation is one more element. So like this, With element spelling only, you can remember all the elements of primary health care. Until now, we have seen that there are 8 elements in the primary health care, and now we will see principles of primary health care. That means primary health care is working on what principles, on the grounds of what principles. There are 4 principles of primary health care you should remember. So, first is equitable distribution, community participation, intersectoral coordination, and appropriate technology. And we will discuss in detail about each and every principle. First principle is equitable distribution. Remember the term equitable, not equal. So equitable and equal both are different. You can see from the right side diagram that equal distribution means irrespective of the need, we are giving equal health services or equal share. We are giving irrespective of the need. So, say for example, this first person don't need any stool to see that match, but still we are giving. And second person need one chair, and we gave stool. And third person also we gave the same stool, but it is not visible to them. That means he need 2 stools, but we gave only one stool. So that is irrespective of the need. We are giving equal importance or equal services to all the people. So that is equal distribution. So in place of this equal distribution, we can follow equitable distribution. Equitable distribution means here we are not giving to the people who don't need, and we are giving more services to the people who need more. So that is equitable distribution. So equitable distribution means giving more healthcare services to the more needy people, simply. And this is the first key principle in the primary health care strategy. And we have seen that there was so much inequality in the provision and availability of healthcare services, especially in the olden days. According to 2011 census, 75% of the population resided in rural areas and 25% population resided in urban areas. But in contrast, healthcare services or hospitals are more concentrated in urban areas compared to rural areas. Say, for example, 75% of the healthcare services were there in urban areas, and 25% of the healthcare services are there in rural areas. So it is opposite, it was there. So there we face the inequality in availability of healthcare services. And to deal with that inequity in healthcare services provision, we brought the concept of primary healthcare, and in that it worked on equitable distribution principle. That means provision of healthcare services, establishment of hospitals, especially in the rural areas where the people need more. So after this primary healthcare concept only, primary health centers, sub centers, Anganwadi centers were established in rural areas, and now they are the backbone of healthcare services in the rural areas till now. And in the olden days, the supply of healthcare resources were more towards affluent areas or urban areas compared to rural areas. But now we are trying to cut down that with help of this primary healthcare concept, that too equitable distribution principle. Farmers residing in those villages were trained, and they were given basic equipment, and they were given training to identify the common health problems and give treatment to them. So this worked best, and it improved the indicators of health, like it decreased morbidity rates and all in China. So this was done because of lack of healthcare services in rural areas in China. And those farmers who were given basic training about healthcare were known as barefoot doctors. And third principle in primary healthcare is intersectoral coordination. We know that along with healthcare sector, other sectors are there, like all these electricity department, transport, water works, Ram Panchayat and all. So if we collaborate with all those departments, depending upon the health service we are giving, it will be more successful, or it will be implemented efficiently. And we are doing intersectoral coordination also to prevent duplication of services. So this department is doing the same services, and other department is also doing the same, where funds are utilized multiple times. So to decrease the, or to prevent the duplication of these services also, we are doing intersectoral coordination. And this intersectoral coordination we will discuss with one example of conducting a deworming program on National Deworming Day. So to conduct this national deworming program, so we need albendazole tablets or syrups, and we will conduct this deworming sessions in schools and in colleges to 1 to 18 years old children. Schools, colleges, and less than 5 years children will be dewormed in Anganwadi center. So in all these places, deworming program will be conducted. And on that date, to conduct it efficiently, we should utilize the services of other sectors also. Say for example, information and broadcasting. So we are going to conduct this deworming program, say for example, in Warangal district on this date, on this time, in all the schools, government schools, colleges, and in Anganwadi centers, like that we are going to conduct like that. We should broadcast in TVs, newspapers, social media. So like that we should broadcast. Then utilization will be increased and awareness will be increased by using this sectors. And also on the day, to implement successfully, power should be there, and water supply should be continuous. Then only proper hygiene can be maintained, like that. So even we should collaborate this with the Gram Panchayat and waterworks and electricity department, and to bring the stock, so there should not be any problems during transportation. So for that we should collaborate with transport authorities also, like that. To conduct any health program or to give any healthcare services, depending upon the healthcare service, we should coordinate with other sectors also if needed. And fourth principle in primary healthcare is appropriate technology. Remember, it is appropriate technology, not advanced technology. Appropriate technology means a technology which is scientifically sound. That means it is proven to be effective, scientifically sound, and it should be acceptable to the local needs, and which should be acceptable to the people, and it can be maintained by the people themselves, and and it will rely on the principle of self-reliance. Self-reliance means those people can follow that healthcare services without help from others. So that is self-reliance. So we will discuss with one example so that you will understand better. Shark tape, ORS preparation, and growth charts are examples of appropriate technology. So shark tape, we all know, it will measure the mid upper arm circumference in under 5 children. So it will have three colored zones: green, yellow, and red zone. Even markings will be there, like how many centimeters are there and all. So if I ask you suddenly what is the cutoff for mid upper arm circumference, to tell it as severe acute malnutrition. So you as a medical student will try to remember, and some will tell correctly and some will not tell correctly. So but this shark is tape. So visually it can tell whether the child is in malnutrition or not, depending upon the zone they are in, yellow or green or red. So this mid upper arm circumference will be measured easily using Shakis tape by the grassroots level workers like Asha worker, Anganwadi workers. So they will measure and they will identify at that point of time only. If it is in green zone, they will know that they are in not in malnutrition, and if it is in yellow zone, the child is in mild to moderate malnutrition, and the child should be referred to higher centers. And if it is in red zone, then the child is in severe acute malnutrition, and they should be immediately referred to higher centers. Like that they will think, and they will follow that. So this is a simplified technology, so that is scientifically sound, and it can be used by the grassroots levels, and it will be adaptable to the local needs, and it is improving the self-reliance of the grassroots level workers. So that is Shakir step. And one more example is ORS preparation. Say for example, one person is suffering with diarrhea and that person is having dehydration. If we suggest them to go to travel to so much distance, and IV fluids they will inject like that, if we tell, some people will go and some people will not go because of the distance, because of the because they are afraid of injecting IV fluid like that, they will they may or may not go. But instead, if we tell that I will give one ORS powder packet, and you should mix it in 1 liter boiled and cooled water, and you should consume within 24 hours. If we tell that, so they will think it is very simple, and I will follow like that, and they will follow, and their dehydration status will be corrected. So so this ORS is also scientifically sound, and it is easy to implement, and it is based on the self reliance principle. So like that. And same like growth charts also, it is visually it will depict whether the child growth is proper or not, because it will have three colored zones: green, yellow and orange. So every month these Anganwadi workers will check the weight of the baby, especially under 5 children. So they will mark the weight. So in that growth charts, which will be attached in the MCP card, Mother and Child Protection card. And while tracking this growth, while tracking this weight, whether it is in still green zone, or if it is going into yellow zone, or if it is going into red zone, they will see. If it is green zone, then the growth is okay. If it is in yellow zone means, so the growth is not good, and nutritional status should be improved, and like that they will think, and they will refer to higher centers. And if it is in orange zone means, so it is very serious, and they will immediately refer to the higher centers. So like that. So these technologies are, as we discussed, scientifically sound, easy to implement, and it will depend upon self-reliance technique. This is about primary healthcare elements, principles in detail, and subscribe, like, share for further videos.